Greetings, everyone, and welcome. My name is Carrie Gray, and I am the Adult and Senior Services Specialist for Prince George's County Memorial Library System. And welcome to the Golden 30. The Golden 30 is a 30-minute program series geared to older adults that is available by phone and online. You can access this program 24/7 by phone at 240-455-5460. This month, we will discuss, is it aging or inactivity, with Dr. Shanelle James of LimbsNThings, LLC. This presentation will explore our biases towards aging and learn how to determine if symptoms experienced are from inactivity or aging. Participants will also learn how to combat some signs of aging through physical therapy with a normal routine. First, let me give you a little bit of background about today's presenter, Dr. Shanelle James. Dr. James is a native Washingtonian and is also CEO and licensed physical therapist. Her quest to become a physical therapist began in elementary school when she observed her father go from injured to well following physical therapy treatments. Ever since then, she has been on a quest to become a doctor of physical therapy. She earned her Bachelor of Science degree in recreational therapy in 2009 from Alabama State University. Dr. James earned her Certified Therapeutic Recreational Specialist, CTRS, certification while matriculating through her first year of ASU's DPT program. Dr. James is a licensed in Washington, D.C., Virginia, and has worked in skilled nursing, outpatient facilities, and early intervention in D.C., as well as home health, house calls, and inpatient rehabilitation in Virginia. In each setting, Dr. James has developed a rapport and fun rehabilitation tasks to achieve functional goals of each patient. She vows to bring to LimbsNThings all that she has acquired from these different experiences to ensure her patients never give up and reach their optimal function from the inside out. Please follow her on social media like I do. She has fun videos that will encourage you to keep you active and just healthy in general. So welcome, Dr. Shanelle James. How are you?
I'm good. Thank you so much for having me, Miss Gray.
No problem. So whenever you're ready, let's get into it. Is it aging or inactive?
All right.
Mm-hmm.
Well, good morning, everyone. We're going to talk about, is it aging or inactivity? My name is Dr. Shanelle James, and I hope this presentation helps you to determine if you're being inactive or some of the things you're experiencing may be just related to aging. So let's talk about it. Nothing says I'm aging gracefully like, how would you finish this sentence? For me, I'd say tone, muscles, and skin. What about you, Miss Gray?
Yeah, I think it's how you feel. I definitely feel like I guess always having a youthful attitude.
Okay, that's a good way to think about it.
Mm-hmm.
What about this one? Nothing says I'm getting older like.
Nothing says I'm getting older, and I'm just gonna go there. Your body. Your body.
Okay.
Nothing says, like I'll just say either physical limitations or changes in your body.
Okay. For me, it's gray hair. It's things that we look at and see in someone else and like, oh, we can tell how old a person is. What about this one? Nothing says I'm sedentary like, or I'm not moving as much like what?
Okay, this is gonna be funny, but the sit down, when you even try to sit down and you get a little stiff on the get down. So I would say
okay.
down.
And then I would say taking multiple attempts to stand up. Like if you're having to rock and stand, or if you get to the edge of the seat and then you can't get up in one try, that says you're a little sedentary.
Okay.
So inactivity, that's non-action, just not moving enough. And aging is just the process of growing old. As we continue to have birthdays, we continue to get a little older. And that's just the simplest way to describe inactivity and aging. So let's talk about which one of these signs are inactivity or aging. Okay, so I'm gonna ask you and then you tell me if it's inactivity or aging. You ready?
Okay, I'll try.
Here we go. Here we go. Weakness.
I'll say weakness is aging.
Okay. Loss of balance.
Inactivity.
Hearing loss.
Aging.
Reduced eyesight. Over time now.
Okay, because I wear glasses now, but
Me too.
I'll say aging.
Okay. Pain.
I'm gonna say, oh, these are hard. I'll say aging.
Okay. Joint stiffness.
I'll say inactivity. Some of these are mixed though. I feel like some of these.
Stiff blood vessels.
Inactivity.
Drier skin.
That's aging.
So I'm going to answer them. Weakness, loss of balance, pain, and joint stiffness. Those are all inactivity signs. Hearing loss, reduced eyesight, but stiff blood vessels and drier skin. That's all a sign of getting older. Yeah, some of them right. Okay, pain and joint stiffness. Let's talk about it from an inactivity point of view. If we have stiff joints, then that begets having pain when we move in less familiar positions. So if you're sitting more throughout the day, when you get ready to stand up, then you feel like, oh man, my knees hurt, my back is hurting, because you haven't been doing that activity as often. And so your joints are like, hold on, we're not used to moving like this, right? So joints have less lubrication and range of motion when we're inactive. And so it's so important that you spend an equal amount of time. If you're sitting for 2 hours, you should stand for 2 hours, for example. Let's talk hearing loss and reduced eyesight. I know we've been to someone's house that has the TV turned up louder, and we've seen people that use reading glasses, or maybe you need reading glasses. Those could be due to having a reduced blood flow in your eyes or in your ear area. Weakness and loss of balance. So a way that we can combat inactivity is making sure that we have our muscles pull on the bone, and that only happens with demand. So if you are doing like a reach where you're trying to get something off the floor, or you're trying to reach and put on your shoes, if you're doing those things, your muscles have an opportunity to pull on those bones. You can really tell it when you are bending to put on your shoe and you leave your leg straight and you're trying to reach down. You feel that tightness in the back of your knees, that's your hamstrings, right? And we need that to pull on the bone there. And challenging our balance. When we stand, a good way to challenge our balance is to put our feet together. And if that's challenging for you to do, having your feet apart and just closing your eyes, making sure that you're staying close to something, because we don't want to have you fall. And then bearing weight increases the strength of your arms and legs. We have to have resistance to increase the strength of our arms and legs over time. And as we age, we kind of get weaker if we don't continue to do that. And you don't have to use weight. You can use your own body weight. You don't have to have like a free weight or anything like equipment to use. You can use your own body weight. So dry skin and stiff blood vessels. This one is kind of near and dear to me because I find that a lot of people have these that I see. So dry skin, if you're like me, you like a hot shower, you should probably turn the temperature down a little bit when you take a shower. You want to make sure that the water is warm so that it's not drying out your skin, and it improves that moisture retention in your skin. So after you get out the shower and you put on your lotion, or your cream, whatever you may use, you want to then move, making sure that you're getting that lubrication on the inside of your body as well. And if we look at stiff blood vessels, even though these are signs of aging, we have sensors in our body called baroreceptors. And their job is just to determine when those blood vessels are getting stiff and when they're not, right? And sometimes when blood vessels are stiff, they can cause us to have dizzy spells when we stand up too quickly. We term that as orthostatic hypotension, where you have low blood pressure when you're standing versus when you're lying down. And it's just important when you have that type of condition going on that you gradually take your time to come into a standing position. And so the key to that is gradual movement. So what can we do about inactivity? Now, these are my little people. And I always tell them that walking, working in your yard, and standing, those all constitute exercise. It doesn't have to be something formal. It needs to be something fun so that you will actually want to do it. If it's something that is taxing, you're not going to do it. So you want to do something that is fun for you to do. If it's dancing, if it's walking, if it's playing a game, you can play a board game standing up, and that increases the strength of your legs too. So there are ways to incorporate things that you like to do that you think might be sedentary into being more active. So what can we do about aging? Most importantly, especially if you are approaching retirement or of retirement age, don't retire and then not have a plan for moving on a regular basis. A lot of our activity comes from having a job and then going out every day and doing that. You just want to stay active. Spending time with your pet or younger family members helps you to be active. And then just refusing, I'm not going to be inactive, is a way to make sure that you can continue to age gracefully. And then, of course, if you notice that you're having a difficulty staying active, you can see a physical therapist. And above all, for me, is maintaining a personal relationship with God too. When should you seek a physical therapist for inactivity? A lot of people think I have to be having a real problem to need a physical therapist. You can come see us on the reactive side when movement hurts. But if you want to be proactive and you just want to move better, you can see a physical therapist as well. And then if you've had any change in your functional status, whether you're going from living in an apartment to living, say, with a family member that now has steps, that's a change. If you're going into a hospital setting and you're needing to come back home and learn how to be safe in your environment, that's a change in functional status as well. What do we do? A lot of people think they know what physical therapists do, but let me help you out a little bit. So we analyze what you say, how you say it, and how you move so that we can determine the cause of whatever movement challenge you're having. A lot of times what you say helps us to know where the pain is and how it's affecting your daily life, but how you say it tells us if it's completely interrupting it, whether we can determine if it's pain related to nerve, muscle, or bone, and then determining what cause, how we can address or help correct the problem that you're addressing. So how do we do it? We prescribe exercise. We also prescribe assistive devices, right? So if you need a walker, a cane, a wheelchair, perhaps you need a referral to another healthcare provider, using different modalities, whether it's electrical stimulation, dry needling, taping, all of those different things. Of course, there are many more. And then position adjustments and postural corrections. A lot of our pain comes from habitual positions. And if we sit upright or we stand in a different way, if we actually look in the mirror and see if there's any malalignment or asymmetry in how we're positioned, it can correct so many of our pain issues. And then, of course, we look at how you walk. So that gait pattern sequencing, when we give you assistive devices, we look at which side of you needs to be more aligned or which area we're trying to improve how you feel when you're walking or going up and down the steps. Those are all things that we do to help you to be your optimal self. But what areas do we treat? So there are 5 major systems that we are geared to work with you on to rehabilitate, to maintain, or prevent movement dysfunction. So the skin, did you know the skin is the largest organ in your body? So we have to know how the skin interacts. Your skin integrity helps you with movement. So we're looking at scars. I've had a patient before who had a road rash where he ruptured his gallbladder and they had to open him up. And then we use the wound vac to close the skin around that area. And then a lot of people just don't know that physical therapists do wound care, right? So looking at your scars and seeing if it's healing properly, those are other ways that we work with you. And then with the musculoskeletal system, what probably everyone knows about, is helping people post joint replacements or amputations, or if you've had a recent surgery. All of those ways we help you to regain strength and range of motion with your musculoskeletal system. Then neuromuscular, people who've had strokes, brain injuries, and multiple sclerosis, just to name a few. We work with you there, even Parkinson's disease, to help people to be as functional as possible in their environment, and then to reduce any of the lasting effects so that we have more function and less dysfunction. And then with cardiopulmonary systems, because COVID-19 is so prevalent right now, even though we are on a decline, there are a lot of people who are having residual effects on their lung function. So we work with them to improve their endurance training, as well as with post-pneumonia. There are also other areas like if you have supplemental oxygen and learning how to be as strong as possible with those new changes in your lung function. And then the cardiovascular system. If you've had a heart attack, any type of vascular surgery, we help you to make sure that that blood flow is going as well as it should around to go back to your heart, to the bottom of your feet, and come back around with movement. So those are our areas of scope, or our scope of practice. So again, my name is Dr. Shanelle James. I'm the owner of LimbsNThings mobile and telehealth practice. I serve aging adults in DC, Maryland, and PG and Montgomery counties, and in Northern Virginia. I hope you've gained some information from this. These are ways to contact me, as Ms. Gray mentioned, on social media at LimbsNThings LLC. You can also find us on YouTube at LimbsNThings. There is my phone number here, 202-643-2636. And you can find us online at LimbsNThings.com. We do accept Medicare, TRICARE, and self-pay, and we're always willing to help you. Thank you so much, Golden 30 attendees, and Ms. Gray, and the PG Memorial Library. Appreciate you guys. Thank you.
Thank you so much, Dr. Shanelle James. Let me be your applause. Thank you so much.
I appreciate it.
For an excellent presentation. I was writing down questions, and guess what? The next slide or a few slides answered it. Thank you just for a well comprehensive presentation. It was awesome. Also, I just thought it was very interesting that you highlighted, and if you want, you can go back to your contact screen so people can have the information to contact you. Yes. Definitely stay connected. I just want to say, like, I follow her online and I find her videos just great motivational reminders to stay moving and active throughout the day. And also, I just wanted to say, I thought it was very interesting how you said people will to see a physical therapist before. And I thought that was very interesting because I think people think usually you see a physical therapist after a trauma or a diagnosis. So I thought that was very interesting. Also, I did not know a physical therapist did wound care. I thought that was very enlightening. And because you are mobile, correct? Like, so you do those house calls, and that is excellent. And do you do any work with, I guess, seeing how people live and seeing potential issues, not necessarily, I guess, ergonomic, because you were talking about sometimes it's our posture, is how we sit. So I guess that would be an added benefit for you coming into the home, seeing if things need to be modified or adjusted for use, correct?
Right.
Okay.
Yeah. Yep,
Awesome.
home
Awesome.
safety evaluations.
Awesome. Awesome. Also, just for curiosity, because COVID-19 is still a big topic, it has changed our lives more than we know. Are
Right.
there anything in particular you're seeing now as far as people begin the rehabilitation process as they have, gone through COVID-19? Is it anything, you can say that you've seen?
I have. I've had a few people who have been on the recovery side and have had new cases of having to use oxygen on a continuous basis and trying to work with the physicians to wean them off to the point that they're able to go back to not having to use supplemental oxygen. And then working with endurance training because so much of COVID has been related to your lung function. So people are getting winded with standing up or getting winded with going 2 feet, and so we're just working on increasing endurance, but also scaling it so that it can be specific to them and what they are trying to achieve. Yep. And then there's so much unknown. So we're still figuring out, how to best help someone. And we're finding that it can also be lung function, but some people are also having issues with pain. And that some is related to getting the vaccine, which is interesting.
Interesting. Thank you for that. I feel like we can talk so much about this, but I definitely want to encourage all of our viewers and listeners to definitely contact your doctor, get referrals. You already have someone in mind. We have Limbs and Things, but make sure that you contact a professional, or even if you have more questions. I think what Dr. Shanelle did a great job is changing our mindset on how we really think of a physical therapist. So definitely take that in mind. Once again, I want to thank Dr. Shanelle James for her time and giving her this great information. And if you want to continue your journey, did you know that with your library card, you have access to health and medicine resources? They are free and online at our website, which is pgcmls.info, INFO. All right, we have AHFS, Consumer Medication Information. Now, this is a trusted source of patient drug information. It is available in both English and Spanish. Also, we have Health Source, the consumer edition, and we also have a nursing and academic edition. But the consumer edition gives you access to nearly 300 consumer health periodicals, including American Fitness, Better Nutrition, Fit Pregnancy, Harvard Health Letter, Men's Health, Prevention, and Vegetarian Time. So please take advantage of these free online resources at the library. And also you can come on in and get you some books or maybe DVDs to keep you active and even safe in your own house. Thank you everyone for tuning in. My name is Carrie Gray. Please feel free to check out our archived content on our YouTube page. Thank you. Have a good day.